Okay, so you've got hammer toes and they're painful for you. How are we going to deal with that? Initially, what we're going to recommend is conservative treatment, and for most people that's going to mean a shoe that's got lots of space up in the front part of the foot. Something that is deep from top to bottom, and ideally something that is relatively wide to allow for lots of space for those toes so that they're not rubbing in the shoe. Because for most people, that's really what causes the discomfort, is the fact that the toe is a little bit crooked and is rubbing on the shoe. Some people will get some pain underneath the forefoot, and so we can talk about orthotics or even spacers or pads that can go into the shoe, and a lot of times that's all that needs to be done. As far as straightening the toe, as long as the toe is still flexible, then we can get away with using splints or pads, or even some taping can be sufficient to correct the problem and keep you going without surgery. Ultimately, if those conservative measures fail, then we have lots of different surgical procedures that we can consider, and it really is taken in a case-by-case basis what the problem is that's underlying and how we need to correct that. And for some patients, there will be some arthritic changes in there, and so we need to address that at the joint, because with arthritis, the cartilage is wearing out inside the joint. And so part of the correction will be to deal with that arthritic joint. For others, the joints are okay, and we can address the hammer toe by rebalancing the ligaments and tendons. And for most patients with hammer toes, it's going to include some sort of an implant. And whether that is a temporary pin for 3 or 4 weeks, or whether it is an actual implant that goes into the bone and stays in the bone, again, is something that we sort out kind of on a case-by-case basis. We'll talk more about what to expect after surgery in the next session.